Karen Livesay, I'm from an organisation called Voluntary and Community Action Wirral. I'm not within the medical sector. We're an organisation that work around community engagement. We have networks of networks, contacts within the community, and we host our local involvement network as well. We were approached by our local Commissioner for End of Life and Cancer Services to get involved in this programme of community convener events that Merseyside and Cheshire Clinical Network funded. Obviously, because for our part in that was around community engagement, having our contacts and our networks, we could try and get people to the events to try and raise awareness. When the request came through, it was one of those moments where you kind of think, this is going to be really difficult. Do we want to do this? And I thought, I understand why we need to do this, but I'm just not quite sure how we're actually going to get there. So we agreed to partner up on that project and see if we could engage with people and really get them along to this event and talk about the issues that they're facing. Those events were the catalyst for more work on Wirral. That was the first time that we'd actually had some focused time on a specific issue with local community members to try and talk this through. And those events are what drove us forward locally. I think my learning from those events, because the subject was new to me, although I had the eureka moment where I thought, I get this, the subject matter itself was relatively new to me. So my learning on the day was that I was blown away by the piece of work that we did around identifying assets within the community. I think looking at how many networks, people, skills, services that we identified just with those 20 odd people in the room was amazing. The vision that we agreed on that day was that our community vision is to take away the fear of talking about death and dying in order to break down barriers, improve people's understanding and increase access to support. There are outcomes from the event that we're really proud of. We have established a community network which is made up of local volunteers, and it looks as though that group will continue as part of the Older People's Parliament that we have on Wirral. The Older People's Parliament have decided that this is a key work stream for them. And we've also got Wirral Well. Wirral Well is the online information directory that I spoke about earlier, and that's growing from strength to strength. We have got some more interest in that from public health and the clinical commissioning groups. So we are looking to have a dedicated area on that where there will be information about services that could help people during their phase of end of life, or their carers or family. So that's something that we want to take forward. So we are looking to try and re-engage with the clinical commissioning groups and public health to try and take the work forward. We've also, as an organisation, taken a little bit of a risk. We've recruited a health and wellbeing development officer to try and drive forward some of this work. We've secured funding from the clinical commissioning groups to work and engage with their patient participation groups and patient reference groups. So as part of that person's role, we're going to be asking them to look at trying to break down barriers to death, dying and loss, and have those conversations with those patient groups, try and get more champions on board to try and spread the word even further.